Hi, everyone. My name is Emily,
And I'm Alisha.
and our other team members are Natalie, Kailey, and Brennan. We are all Master of Public Health candidates at the Department of Population and Family Health at the Mailman School of Public Health. And today we are presenting our final project from the Data Science 1 course, Attacks on Aid, Quantifying Risk of Violence Toward Aid Workers in Global Humanitarian Settings. Given our collective interest in global health systems and humanitarian settings, we wanted to explore violence against aid workers. Attacks on aid workers have progressively been increasing globally, particularly within the last few years. As global aid-seeking populations swell due to rising social political tensions, climate change, and resource scarcity, aid workers have become even more important to the global public health landscape. However, despite calls to protect aid workers, there is a paucity of data available on the factors associated with risks of violence, and data is generally inaccessible to lay audiences. We used various datasets and data science tools to examine, animate, and effectively disseminate findings about attacks on aid workers. We produced valuable insights and easy-to-use interactive tools, which can help inform lay audiences and stakeholders alike as this pressing issue continues to grow in scale. Our analysis found that national aid workers are at a heightened risk of attack. Data since 1997 suggests that Afghanistan, Syria, and Sudan are the most dangerous countries for aid workers. Data from Afghanistan suggests that aid workers are intentionally targeted by armed groups. So we scraped data from the Aid Worker Security Database by Humanitarian Outcomes, which has data on aid worker attacks globally since 1997. We imported the data into R, cleaned it using various tidyverse packages, and conducted EDA. Our EDA examined various trends in global attacks. We also focused additional exploratory analysis on Afghanistan, supplemented by data from the Uppsala Conflict Data Program. We created an interactive dashboard and leaflet map based on global data with Flex Dashboard. We utilized R Markdown to conduct our analyses and to produce our dashboards. We rendered these R Markdown files as HTML and hosted our website using GitHub pages. This was an effective and relatively smooth way for us to conduct analysis and disseminate results to potential stakeholders and lay audiences. Our comprehensive website also includes a final report with additional details on all of our methods, and throughout the project we used GitHub in order to collaborate.
The outcome of our project is an interactive, user-friendly website which highlights key factors associated with aid worker attacks. The analyses and tools we produced can raise awareness among the public and inform actionable strategies for humanitarian organizations. As mentioned earlier, data on aid worker attacks is not readily available or comprehensible to lay audiences. Our work addresses this issue of accessibility both through these more curated pages with easy-to-follow graphs, plots, and insights from our EDA, as well as through a number of interactive tools and maps. Our EDA provides disaggregated insights about attack trends over time. Each dip and spike translates into lives lost. By synthesizing qualitative information such as news articles, photographs, and timelines illuminating social political context, along with our EDA in Afghanistan, we developed a case study illustrating the context behind the high attack numbers and changing attack trends which we saw in the data. In addition to the analyses we provide, our website's interactive components allow users to explore their own questions and to learn more about the what, when, and how behind attack trends. The interactive dashboard allows users to examine attack rates over time by means and location of attack and to explore the disparity in attacks between international and national aid workers. We added a geospatial component to our project by creating maps, which serve as a powerful tool that allow users to visualize the data across both space and time. On the side, you can see a snapshot of our global map. The implications of this work are far-reaching, especially in the era of COVID-19. The fields of global health and humanitarian aid have moved rapidly towards employing larger numbers of local workers rather than international. We know from previous pandemics that outbreaks can exacerbate tensions between civilians and medical staff, placing aid workers at increased risk of attack. As COVID-19 vaccination efforts continue to roll out globally over the next several years, our data emphasizes the importance of placing additional protections on national aid workers who will be key to ensuring equitable distribution of life-saving drugs. In addition to COVID, aid workers are crucial in the face of rising social political tensions, climate change, and resource scarcity. Our website is a tool of advocacy. It increases awareness about aid workers' deaths in a way that is accessible and useful to both stakeholders and lay audiences. Interactive and multidisciplinary tools and platforms are key to engaging a broad audience, ultimately drawing much needed attention to the vulnerability of these life-saving caregivers. Through raising awareness, we hope that our project will drive the concrete actions needed to end preventable deaths. Thank you.